I'm here at LSI 2026 in Dana Point, California, seeking out innovations in kidney care. And I'm here with Kelly, who happens to be the CEO of CloudCath, and she's going to tell us what they're up to.
Well, I would agree with you, Qasim. You have found the innovation in kidney disease. At CloudCath, we are an FDA-approved remote monitoring device. We go home with patients who are on peritoneal dialysis.
Okay.
And what we do is we integrate with their cycler.
Okay.
And we are monitoring their fluid. And the
Okay.
benefit is
The
that
PD fluid that's coming out,
Yeah.
you're literally monitoring that and looking for what exactly?
we're looking for signals of peritonitis.
Okay.
And what's significant about this and why we actually qualify as innovation is, do you know right now, the expectation is that patients who are already stressed with multiple conditions are expected to monitor their fluid themselves?
Yeah, yeah.
Can you imagine the stress
Yeah.
of having to detect that? So you're doing peritoneal dialysis at home.
Yeah.
You don't have a doctor. You don't have a nurse.
Yeah.
You probably have 5 conditions.
And peritonitis is such a traumatic event that oftentimes it will take these patients off of dialysis, peritoneal dialysis, home dialysis for good, right?
Yes. Which
Yeah.
is a significant loss for patients who are trying to reserve any kind of freedom they may have despite their medical conditions. And to your point, as far as pain goes, we had a patient recently that said peritonitis is 5 times worse than childbirth.
Really?
Yeah. And
Wow.
on top of that pain, these patients are going to end up going to the hospital. Often
Yeah.
they're not going to detect it themselves. Who would?
Yeah.
So the infection is going to progress quite significantly. These patients end up in the hospital. And unfortunately, at most hospitals in America, they're not going to call in a nephrologist to review the case. And so oftentimes that patient is going to lose their catheter.
Yeah.
And now, on top of having a really intense infection, now the patients have to make yet another significant life change, which is moving from at-home peritoneal dialysis
To the center.
in-center dialysis,
And you know
which
what's
you and I
interesting?
can appreciate as
So in
tough.
business, you have this concept of like customer retention, but we don't talk about patient retention
Not enough.
And these programs, like if we could retain these patients, those home programs could grow more. Those patients could have more of a lifespan or a entire life, if you would, with the PD. And so, but what are you guys looking for in the fluid exactly?
So what CloudCath does is we detect white blood cells.
Okay.
So we have an algorithm, and
Okay.
what our original data show is that we can actually detect the patients at risk 3 days before they have symptoms. And what that means to the doctor is that gives you 3 days to call that patient in for labs and initiate antibiotics.
Okay.
And this is how we get our data preventing patients going to the hospital.
Yeah.
Is that you have 3 days now to react
Yeah.
instead of following symptoms, which is usually the path directly into the hospital.
And you are deployed in the United States, correct?
Absolutely. So we released data at ASN last year.
Awesome. Okay.
We've shown a 45% reduction in hospitalizations.
Okay.
We've shown a 56% reduction in catheter loss.
Okay.
And so we presented that data in November, and I have to say the demand has been exponential since then. So we've deployed in 2 major dialysis organizations in the United States. We have a number of nephrologists that have been taking up the device quite rapidly recently.
I can imagine, especially those with the home programs, like they really need
Absolutely.
to. So
Yeah.
I really appreciate this. I look forward to getting some of my patients on your device. So,
We do too, and we wish them well.
all right, take care.